bacterial diseases. So again, good afternoon, everyone. We are now at the second coverage for your last long exam. So hopefully last long exam nyo next week pa siguro. So at least a week before the actual end of the class. So we are now at bacterial diseases. So this is the second topic out of 6 since nadagdagan ng isa yung kay Doc Lyle. So bacterial diseases. So wala pa. So napag-usapan na natin ng konti ang mga bacteria. So bacteria are microscopic organisms that can grow in different kind of environment. So most of the bacteria na common sa mga animals natin are ubiquitous, meaning they are naturally present in the environment. And some of the bacteria actually are opportunistic, meaning kapag mahina ang immune system ng animal, doon sila aatake. Pero if okay yung ano nila, paminsan na present sila sa digestive tract, sa normal digestive tract of an animal. Kapag lang humina yung animal, doon sila mag-take over. So, yan. Okay. So we will now talk about the common bacterial diseases. Again, these are not all of the diseases and these are not all of the common diseases. Pero pumili ako ng I think 10 sila na bacterial diseases for animals, domesticated animals. So our first, sige, mark ko na lang yung mga humabol mamaya. Chat na lang kayo. No? So our first disease, bacterial disease is exudative epidermitis. So anong makikita nyo dito? Can you give a description in this pig? Can you describe this pig? Kahit ano lang, anong unang agad nakikita nyo? Anong description nyo dito? May other name ang exudative epidermitis. Diligan ko kung masatsyempohan nyo kung may magta-try man sa inyo. Wala ba? So, parang galis daw. Kinda, yeah. Sa bagay, no, yung mga matitinding galis, ganyan nga yung parang nalalagas nga yung buhok. Pero, the other name for exudative epidermitis is greasy pig disease. So, greasy pig disease. Mukha siyang ano nga, greasy. Yung oil na dark na. So, exudative epidermitis is also called the greasy pig disease. So it is caused by Staphylococcus hyaccus. And this disease, in this bacteria is usually present in the skin of animals. Some of us may have this bacteria. So Staphylococcus are gram-positive cocci bacteria that occurs in plaster. So familiar na ba kayo sa difference of gram-positive and gram-negative? Are you familiar? Na-discuss na ba sa inyo nung junior nyo, high school nyo? Ba't natin na-define as gram-positive or gram-negative yung some bacteria?
Parang hindi po, sir.
Okay. So, as you go along your vet studies, especially pagdating nyo ng third year when you will discuss about microbiology. Guys, kapag micro na kayo, huwag niyong ibabagsak yun ha. Madaming nade-delay na vet med dahil bumabagsak sa micro. So, kakabutihin nyo doon. So, anyways, so bacteria can be classified para sa easier diagnosis through gram staining. So, it is discovered by Hans Christian Gram ata ang pangalan niya, na he discovered a technique in which a certain stains can help in classifying bacteria into two. So, gram-positive bacteria, meron silang thick peptidoglycan layer. So, pagdating nyo ng or search nyo ngayon kung may extra device kayo. So, this thick peptidoglycan layer, siya yung nagre-retain sa unang stain na gagamitin natin, which is crystal violet. Crystal violet. Ay, methylene blue ba? Anyways, basta Wait. Napaglito kayo mga stains. Wait. Wait lang. I need to verify. Baka ma-fake news ako. I-history ako sa inyo. Wait lang. Tignan ko lang anong main stain. Lang po. So, pagdating nyo ng third year, madaming stains na gagamitin. Wait lang. Sequence. Crystal violet. Sorry. Tama. Rapid deperoxidation, scoreless. Wait lang, tingnan ko yung last stain. Wait lang guys, patanong-tanong pa ako, nakalimutan ko. Saffron, oh. Okay. So, sayas nga. So, sa gram staining, una mong gagawin is expose, get a sample of bacteria, yung nakita nyo. Kung natatandaan nyo pa yung pinapakita kong petri dish sa inyo, tapos merong bilog-bilog na growth of population of bacteria. Okay. So, kukuha ka nun, ilalagay mo yung sample mo sa, let's say, a glass slide. Tapos, i-fix mo siya. So, you fix that bacteria, that sample by staining them. So, first, ang gagawin mo sa gram staining is put crystal violet for, I think, 1 minute. Tapos, iodine, then acetone. So, ang acetone, ang purpose ng acetone is to remove the color, yung stain. So, sa gram-positive bacteria, mayroon silang thick layer ng outer part nila. And sa thick layer na yon, mas nag-a-attach well yung crystal violet. So, yung crystal violet na yon, hindi siya mawawash out ng acetone. So, kapag linagyan mo ng safranin, which is color magenta or pinkish, hindi siya magkukulay pink kasi nandito pa yung crystal violet sa una. So, kapag titingnan mo sa microscope, gram-positive bacteria will appear bluish to purplish in gram staining, and gram-negative bacteria will appear pinkish or magenta in after mo mag-gram staining. So, yun yung purpose ng differentiation ng gram-positive and gram-negative bacteria. So, if nalaman mo na kung gram-positive o gram-negative yung bacteria, kalahati ng mga bacteria hindi mo na poproblemahin. Hindi mo na pagsususpetsahin na siya yung causative agent ng anumang disease na inaano mo. So, that's the benefit of staining your bacteria. So, ano bang ginagawa ng Staphylococcus hiatus sa mga baboy? So, it affects suckling piglets and weaned pigs up to 3 months of age. So, kita naman sa picture na to, bata-bata, mukhang bata-bata pa yung baboy. So, mga bata-batang baboy ang tinatarget ng exudative epidermitis or Staphylococcus hiatus. So, this disease is characterized by widespread, excessive sebaceous secretions. So, excessive oily secretions, exfoliation of the skin, and exudation of the skin or lumalabas yung mga fluids. Kaya mukhang ganito. Lumalabas yung oil, and of course, kapag lumalabas yung oil, most of the time, may stock doon. Kung may dust man na mapupunta, may stock sa oil. At the same time, makaklamp yung hair. So, mukhang madumi yung animal mo. So, morbidity rate or the rate in which animals can get the disease, susceptible animals can get the disease, is 20 to 100%. So, in case pwede kang magkaroon ng outbreak sa farm mo, pwedeng lahat ng baboy mo maapektuhan ng disease na to. And mortality rate can reach up to 90%. So, mataas-taas ang mga apektadong kapag naapektuhan ang mga baboy mo, halimbawa 100% sa farm, there's a chance na 90% ng population ng baboy mo is mamamatay sa disease na ito. So, how can we prevent the spread of disease? So, strict isolation of affected pigs is essential. And the early systemic antibiotic therapy can be effective to combat the disease. For example, administering oxytetracycline to the affected pigs. So, mapapansin nyo, hindi ko na linagay yung diagnosis. Hindi pati sa viral infection, I don't think linagay ko yung diagnosis. Kasi sa mga viral infection, ang diagnosis mo is clinical signs and mga PCR, ano pa ba? ELISA, which are complicated pa masyado for your year. So hanggang treatment na lang tayo. Wag na muna diagnosis. So dito, of course, surest way for diagnosing any disease is isolating the causative agent of the disease. So mag-culture ka ng bacteria para malaman mo anong bacteria yung, kung bacteria man yan, yung nagkakos ng disease sa animal mo. So yun. So we can treat this by giving oxytetracycline to the pigs. So next disease is strangles. So makikita nyo agad dito is mucopurulent nasal discharge. So kind of pus itsura na. So pasensya sa mga kumakain na madaming ganitong picture in our for next slides. So strangles is caused by Streptococcus equi. So it is a highly contagious disease, meaning highly transmittable ang disease na ito. Kailangan init ko ng cellphone ko. So yun. So Streptococcus, kind of similar with Staphylococcus, coccus shape pa rin sila. Ang difference nito, alam ko sa Streptococcus is hindi sila nagka-clump as compared sa staph. Streptococcus, I think, bipair sila pag titignan mo under the microscope. Dalawang bilog na magkadikit. So they are also gram-positive and occur in cocci chains. So cocci chains, hindi clusters of circles, clusters of parang grapes, hindi ganon. So strangles or Streptococcus caused by Streptococcus equi is usually affects young foals. So foals are young horses. Although horses of all ages are susceptible to the disease, pero mas apektado ang mga young horses natin. So ano bang clinical signs of strangles? So clinical signs typically include high fever. So kaya dito importante alam mo ano ang normal temp ng horses. I think 37.8, 37.9 ata if tama pa tanda ko sa table. Depression and anorexia. Hindi ganong kumakain. So these signs are then followed by purulent oculonasal discharge. So when we say oculonasal, involved din ng eyes. So may lumalabas din na discharge sa eyes which is purulent or pus, mukhang pus. Alam nyo naman ang nana, no? So, yan. Ito, parang dried up na ng konti. So, morbidity or the chances of animals being affected sa farm, 100%. So, if nagkaroon ka ng isa, most likely lahat ng animals mo magkakaroon na rin within, let's say, a week. So, mortality naman, though mataas ang morbidity, mababa ang mortality. So, 5% lang. So, very manageable ang disease na to, yung ganun ang data natin. So, you will encounter many diseases that have high morbidity but low mortality and low morbidity but high mortality. Pero some diseases naman, mataas na nga morbidity, mataas mortality. Yun yung pinaka tinitignan, pinaka prevent ng government natin, tayong mga veterinarians, when it comes to diseases. So administration of penicillin to in contact and affected horses is recommended for strangles cases. So overcrowding of horses as well as mixing them with different age groups should be avoided as they are predisposing factors to the disease. So since 'di ba nga bata yung apektado pero kayang i-target yung mga matatanda din, mas magandang wag mo nang ipag-mix yung mga bata matanda. For example, yung mga matatanda, since hindi sila gaano affected, they may be asymptomatic carriers of the bacteria. Pag pinag-mix mo sa mga younger horses, hindi mo pala alam, kala mo normal yung mga matatanda, nakapag-pass na pala sila. They are carriers of the bacteria na pala. And nagkaroon na ng disease yung animal mo. So, in case of strangles, mixing of different age groups should be avoided. So, caseous lymphadenitis naman. So, ito na, abscess formation ang sa caseous lymphadenitis natin. So, caseous lymphadenitis is a chronic suppurative condition in sheep, goats, and sometimes, though rarely, cattle. So, it is caused by Corynebacterium pseudotuberculosis. Ayan, mga scientific names na. So, madami pang other diseases caused by the genus Corynebacterium, pero let's focus on the pseudotuberculosis. So, infection with caseous lymphadenitis results in abscessation and enlargement of superficial and internal lymph nodes. So, from the name itself naman, lymphadenitis, usually ending with itis are inflammation and lymph nodes. So, lymphadenitis, inflammation of the lymph nodes. So, affected lymph nodes are enlarged. Paulit daw yung scientific name, Corynebacterium pseudotuberculosis. So, yun. Caseous lymphadenitis is caused by Corynebacterium pseudotuberculosis, and affected lymph nodes are enlarged and exhibit an onion ring appearance in cross-section. So, ito yung onion ring appearance. Mukha naman siyang onion ring, no? Mukha ba? Mukhang kadiring onion ring. Yung onion yung nalulusaw, yung nakalimutan yung ilabas sa storage after how many months. So, ganyan yung itsura. So, ito pag kinuha mo sa animal, inopen up mo cross-section. When we say cross-section, dito sa, halimbawa yung vessel, yung blood vessel, when we say cross-section, ikakat mo siya to see yung loob na basta, maganda po kang picture ulit para sa cross-section kung hindi kayo familiar. So, animals affected by the disease usually become infected with the disease through contamination of shearing wounds or by arthropod bites. So, possible na magkaroon daw ng contamination. Halimbawa kapag shear, inalis mo yung wool ng sheep mo, tapos, in between the sheep, hindi mo lilinis yung yung pag-alis mo ng wool. And nasugat mo, di sinasadya yung sheep. So, possible na mapasa na yung bacteria doon. Or through by arthropod bites or through insects. So, possible daw na magkaroon ng caseous lymphadenitis, mapasa ang Corynebacterium pseudotuberculosis through bites of transmitter insects. So, madami naman tayong disease. Na-mention nyo na yung ibang diseases na transmitted by insects. Dengue, malaria, flea allergies, flea dermatitis can be caused, yun nga, transmitted by fleas. So, yan. Madaming diseases which you will tackle in your parasitology subject. So, because of the chronic nature of the lesions and the ability of the organism to survive inside the cell, treatment is usually ineffective for Corynebacterium pseudotuberculosis. So animals showing clinical signs must be culled. Since usually magde-develop to chronically, matagal-tagal bago mo makita talagang to. Tapos pag nakita mo na malala na yung animal, so hindi na daw recommended yung treatment. So, kailangan, nakita mo na to, alis mo na yung animal mo. Ikal mo na. So, thorough disinfection must be performed at contaminated buildings and equipment. So, fun fact lang about our causative agent, Corynebacterium pseudotuberculosis. So, this bacteria will appear like Chinese characters when you look at them at the microscope. So, yun yung description nila sa mga reviewers namin. So, Corynebacterium bacteria appear like Chinese letters when viewed on the microscope because of their clumping. So, nagka-clamp mga yan, tapos titignan mo sa slide mo sa microscope. Mukha silang, alam mo naman yung Chinese letters, diba? Yung lines na patong-patong. So, i-search nyo man, nung search nyo man yung yung causative agent nito, para mas ma-appreciate nyo. So, yung nakita kong picture, malabo siya nung tinry ko siyang download. So, hindi ko na siya in-include. So, yan. So, next is suppurative bronchopneumonia. So from the name itself, involved ang bronchi and possible na magkaroon ng difficulty in breathing due to pneumonia. So suppurative bronchopneumonia is caused by Rhodococcus equi. So a gram-positive rod or cocci bacteria. So some bacteria, pwedeng hindi lang isa yung shape nila. So in this case, Rhodococcus equi can appear rod shape or coccus shape sa under the microscope, hence its name. So it is generally acquired by foals, so young horses, by inhaling contaminated dust. So present sa ground ang Rhodococcus equi. So this organism is usually present in the feces of young foals up to 3 months of age. So pati sa tae ng mga horse natin present ang bacteria. Yeah, some of these diseases are actually not present in the Philippines, or some of them we try to eradicate. Pero wait lang, tingnan. Pero usually yung mga na hindi present sa Pilipinas na disease are usually the viral diseases. So there's a high chance that these diseases are present. These bacterial diseases are present in the country. And sa discussion namin kasi pinofocus on sila. So baka makita nyo to, mga disease na to sa field. Ito, alam ko, present sa field, aggressive disease. Ito, since konti yung horse racers natin, I doubt. Pero I think baka may positive naman dito. I haven't experienced these strangles, pero ito, may nakita na kami ganito. So yun. So, ano ba? Saan na tayo? O yun, present siya sa soil, at the same time, present siya sa feces ng baby animals. So, clinical signs vary, but acute signs include fever and anorexia, often occur in 1-month-old foals. So, foals, 2 to 4 months naman. So 1-month-old foals, nakikita natin is fever and anorexia. Sa mga 2 to 4 months old naman na foals, they usually exhibit coughing, dyspnea. Dyspnea is nahihirapang huminga, weight loss, and moist rales or respiratory sounds. So kayo, di ba kapag humihinga kayong may sipon pa or may sipon pa, may sound ng konti, paminsan yung breath natin, di ba? So, yan. On auscultation. So, yun yung makikita natin. I can find an actual picture of suppurative bronchopneumonia. So, naghanap na lang ako ng bronchopneumonia picture. So, ito usually makikita mo daw sa lungs. This is the lungs. So, mapapansin nyo, ang lungs, dapat ganito yung kulay. Itong part na to. So, ang nangyari dito, mapapansin nyo, nag-white na ang lungs. And titignan yung edges, though pixelated ang picture, pero makikita nyo pa rin yung edges, rough na ng konti. So, a possibility dyan is meron na tayong infarction dahil nga kulang sa oxygen ang body ng horse, nahirapang huminga, nagkukulangan na rin ng oxygen ang cells sa katawan. So magkakaroon ng infarction, magpuputi, magne-necrotize ang mga some cells, some part of the cell. Itong part na to, nagkaroon na ng infarction. Ibig sabihin, nakulangan na ng oxygen ang namumuting part na ito, which is a lot of part. And take note, most of our organs are not able to reproduce cells again. So some organs lang like liver can recreate another liver cells. So if ganitong nangyari, talagang intensive treatment na kailangan natin gawin for this case. So kapag mag-aano na tayo, pag mag-isolate na tayo ng if nakita mo na nag-uubo-ubo yung foals mo, no? So kukuha ka ng sample, possible from inside the nasal cavity ng animal, or pwedeng kumuha ka sa feces. Since present ang bacteria sa feces, try mong i-isolate ang bacteria ito from the fecal sample. So after that, One characteristic of this bacteria, Rhodococcus equi, kapag in-isolate na natin sa lab, is sa blood agar, so usually sheep blood ang ginagamit natin. Kumuha talaga tayo ng dugo sa sheep and incorporate natin sa agar na ginagawa natin. So sa blood agar daw, they will produce mucoid colonies, yung parang wetish, na salmon pink in color. So sa blood agar, ganito yung magiging itsura ng Rhodococcus equi. I think unique to sa kanila on a blood agar na mucoid and salmon pink yung characteristic. So the recommended treatment for this disease is a combination of oral rifampin and erythromycin for 4 to 10 weeks. So of course, in case hindi mag-work to, madami tayong other antibiotics. Pero based from data ito daw yung pinaka-effective sa kanila. So combination of rifampin and erythromycin for around almost 3 months on treatment. So regular removal of manure is recommended in the farm since yun nga present ang bacteria sa poop ng mga foals. So if aalis mo yun, yung mga susceptible foals, yung mga healthy pa na foals, hindi sila makakakuha ng disease if ever. So yun. Next is bovine actinomycosis. So bovine actinomycosis is, I think, lumpy jaw ang other term of this. So ito, tignan nyo. The jaw of the cattle is masyadong parang lumalawlaw, inflamed. No? So bovine actinomycosis, also called lumpy jaw, is caused by Actinomyces bovis. So Actinomyces bovis is a gram-positive bacteria. So this organism is presumed to invade the tissues following a trauma to the mucosa from raw food or when a teeth is erupting. So opportunistic siya. Kapag tumutubo yung ngipin, magkakaroon ng opening para pumasok ang bakteryang ito. Or kapag halimbawa nakakain halimbawa siya ng matilos na bato or pako na nanguya niya accidentally, since madami tayong case actually nakakakain sila ng bakal-bakal yung mga ruminants natin. So if nasugat yung jaw around the mouth area, dito na papasok si bacteria, si Actinomyces bovis. So ang usually tina-target niya daw ay mandible, though paminsan magsila ang tina-target, and exhibits rarefying osteomyelitis, inflammation of the bone cells. So anong mangyari? So yan, mukhang may lump nga pero ito yung normal. Ito yung cow affected by lumpy jaw. Ito yung mandible niya. So ang laki ng difference, no? So mapapansin nyo, sinira sa loob. Sisirain talaga yung mga bone cells. So rurupok ang jaw ng cattle. Kaya nagkakaroon ng inflammation. Of course, madaming pain yan dyan. And yung bacteria nagkaroon grown up, ina-attract yung mga chemotactic factor which stimulates inflammation. So yan, sirang-sira na ang jaw ng animal. So when lesions are small, surgery is recommended. Pero kapag naman usually kapag malala na yung lumpy jaw, ikakal na natin ang ruminant natin. So kasi can your cattle still recover from this? In case man buhay pa yung cattle pero ganito yung nasa loob niya. So I doubt na good pa rin yung magiging quality of life ng animal mo if ganito na yung bone niya sa jaw. So, ano bang problems na pwede natin ma-encounter dito? First is pain. A lot of pain. Since, yan nga, nag-necrotize deep inside. Magkakaroon ng inflammation which can cause pain. Next is, mahirapan siyang kumain. No? Every ngunguya siya, mahirapan siya. So, instead na pahirapan mo na pang matagal yung cattle mo, kalmo na lang siguro. Those, of course, ay yung pera. So, yung itsura niya po ba? So, bone cancers, I think similar, same description of the signs. Osteomyelitis pa rin. Magbe-breakdown din yung bone. And many of the diseases, many bacteria, many viruses can, and even in non-infectious diseases can cause this, can cause the bone cells to break down. So, yeah, possible. So, yan. Ang itsura niya within the microscope. These are many, many bacteria. I think itong isang fiber na to, bacteria, isang fiber na naman, bacteria, so madaming bacteria yan. So prolonged treatment using penicillin can be of value to infected cattle. So nagumpisa pa lang, maliit pa, i-antibiotic treatment nyo na kung gusto nyo talagang i-salvage yung animal mo. So next is listeriosis. So some diseases, yung name nila is yung causative agent nila. As with bovine actinomycosis, Actinomyces bovis, listeriosis is caused by, wild guesses, anong bacteria to? From the name itself. So this caused by listeria. So listeriosis in ruminants is caused by Listeria monocytogenes. So a rod-shaped gram-positive bacteria. So they tend to affect ruminants fed with infected silage. So if familiar pa kayo sa silage, ito yung ini-store natin yung grass sa anaerobic condition para ma-ferment, para maging mas malasa. If tandaan nyo pa sa lesson natin sa nutrition. So kapag mali yung preparation ng silage, possible na magkaroon ng Listeria monocytogenes. So anong signs of listeriosis? So first is encephalitis. So involve ang brain, inflammation of the brain, abortion, septicemia or blood infection, and endophthalmitis can be observed. So ito yung endophthalmitis. So sa encephalitis, usually sa mga animals affected ng encephalitis, mag-iiba talaga yung behavior nila since brain nga naman yan. So common sa mga farm animals na may encephalitis, nagkakaroon sila ng circling, ikot-ikot sila ng ikot-ikot sa pen, and head pressing. Pinipress, as the head suggests, pinipress nila yung head nila sa wall or any solid structure ng matagal. So, yun. So, ito rin, common, tinatanong to paminsan sa exams. Listeria monocytogenes can replicate in poor quality silage with a pH of 5.5 and they exhibit tumbling motility at 25 degrees Celsius. So, as in, legit, nag-tumbling sila. So, i-search nyo man sa YouTube, tumbling motility listeria, as in, ikot-ikot sila. Like how you tumble. Marunong mo kayo mag-tumbling. So, kapag 25 degrees Celsius or below 30 degrees Celsius, listeria performs tumbling motility due to their flagella. So, flagella, yun yung hair-like structure sa mga bacteria. So, dullness, circling, like I mentioned kanina, and tilting of the head are common clinical signs for listeriosis. So unilateral facial paralysis or one side of the face becomes paralyzed and it can result in drooping of the eyes and ears. So abortion may occur without any evidence of systemic illness. So madaming signs sa listeriosis. So treatment in case man na ma-diagnose mo na Listeria monocytogenes ang causative agent ng disease is ampicillin or amoxicillin. Pero guys, tandaan nyo, any disease that shows nervous symptoms, especially sa mga mammals, assume nyo na possible rabies siya. Always. To keep yourself safe. Since if rabies siya, you will take double care for yourself. So, always assume kapag meron ng clinical signs na involved ang brain, assume na baka rabies ang disease. No? So, any kind of, especially mamas, since sa mamas affected yung rabies. So, yan. Ang penicillin na amoxicillin na pwede natin bigay for listeriosis patients. So, next is swine erysipelas. So, its name na naman, giveaway sa causative agent. So, swine erysipelas is caused by Erysipelathrix rochopathiae, another gram-positive bacteria. So, I think some of you, sa mga may pigarin, nakita nyo na ba ito sa farm nyo? Or if hindi, good. Hopefully, never nyo makita to sa farm nyo. So, swine erysipelas, it can be seen, the causative agent for swine erysipelas can be seen either as small rods in its smooth form or as filaments in its rough form. So, acute infections of swine erysipelas produce smooth colonies. So, smooth colonies sa kapag ina-isolate na natin sila sa agar. So, while chronic cases form rough ones. So, subclinically infected pigs are the main reservoir of the disease. So, yung mga asymptomatic pigs, sila yung common source of the disease. So, swine erysipelas occurs in 4 forms. So, first, the septicemic and cutaneous forms are acute. So, nagpo-form sila ng smooth colonies, and arthritis and vegetative endocarditis as the chronic form, which produces rough colonies kapag in-isolate mo na yung bacteria. So, septicemic form of the disease can occur 2 to 3 days after exposure. Mortality may be high on some outbreaks. So, after yung normal susceptible pig, halubilo niya yung pig na reservoir ng bacteria, normal siyang tingnan pero meron siyang bacteria. So after a contact of them, possible na yun nga physical contact, ay yung pinag-inuman, yun din yung pinag-inuman ng susceptible na normal pig. So possible na mag-develop yung disease. So 2 to 3 days after that. So yun namang cutaneous form. So ito yung cutaneous form. So cutaneous sa labas, sa balat. So cutaneous form is characterized by diamond-shaped erythematous flakes. So diamond skin disease, ang other term for swine erysipelas sa cutaneous form. So diamond shape naman talaga. So yun. Chronic arthritis naman has the most significant negative impact on productivity of pigs. So of course, we don't have pictures for arthritis, pero inflammation of the joints. So if inflame ang joints ng baboy, ano kaya ang possible mangyari? Bakit apektado yung productivity niya? Anyone wanna share their thoughts about that, about this statement? Yes, Miss Veray.
Mahihirapan po siya magbuntes, or if ever man po na mabuntes, syempre po, kung marami po siyang anak, bibigat po yung tiyan niya. Mahihirapan din po siya or hindi niya po kakayanin.
Oh, yun. So, since mabigat ang mga baboy natin, the mere fact na yung joints niya is may problem, mahirapan siyang maglakad, and that may affect your productivity. If, malaki pag pinagkakainan, maglalakad pa ba yung baboy mo? Or maglalakad pa na siya with pain na. So, hindi na ganoon ka-efficient ang food, pagkain nila nun. And yung sinabi ni Ms. Veray, if buntis, mas bibigat, mas mahihirapan yung animal mo. Buntis na nga siya, in pain pa yung nararamdaman niya. So, may stress siya lalo, and there's a possibility, baka mag-abortion pa to. So vegetative endocarditis naman is less common. So, and most animals will appear asymptomatic. So, inflammation of the endocardium. Napass din po ba yung, yeah, oo. So, most of our bacteria, basta magkasugat, possible pumasok ang bacteria natin. Ano, di ko nalagay yung common talagang transmission. Pero most of these diseases that I discussed is through direct contact, yung transmission nila. So, chronically infected animals should be culled. So, yung chronic diseases natin are vegetative endocarditis and arthritis. So, vaccines are available for the disease. We have bacterins to fight this bacteria. So, inactivated bacteria para makapag-produce na ng WBCs na familiar na sa bacteria should the actual bacteria invade your farm. So treatment for swine erysipelas is penicillin and tetracycline. So ito, anthrax. Ito yung sinasabi ko dati sa inyong ginagamit na pwedeng gamitin as bioterrorism. So anthrax, bloated yung animal, and possible na walang, yung blood, unclotted, dark color, tas mapapas nyo tinakpan ang nose. Kasi, kung anthrax talaga to, the causative agent is Bacillus anthracis, they produce spores. So, spores can be taken up by the air, mas lumayo. So, kapag patay yung animal, possible lumabas pa rin through the openings of the animal. Kaya tinakpan yung mouth and nose ng cattle na patay na to. So, Bacillus anthracis causes anthrax. So, they are large, rod-shaped, spore-producing, and are gram-positive. So, anthrax is a severe disease that can affect all mammalian species. Ito yung sabi nila meron pa dito sa Pilipinas, nagkakaroon pa minsan ng anthrax cases. Though I tried to search before, nung estudyante ako, wala kaming nakitang reports about anthrax. Pero according to yung dating doc, si Doc Christian, nagtuturo siya dati dito from CLSU. Meron daw dati na report. So, I'll take his word for that. So, it is a severe disease that can affect all mammalian species, including us. So, although carnivores are relatively resistant, and ruminants naman are highly susceptible. So, the endospores, or the spores produced by Bacillus anthracis, can survive in the soil for decades. Years, lots and lots of years, kaya mag-survive ng mga spores ng Bacillus anthracis. So, actually yung spores, ang pinaka-problema natin when it comes to contamination, kaya nag-autoclave tayo to ensure na yung spores patay din. Since spores can resist most of the heat and disinfectants, so kailangan talaga i-autoclave natin. So autoclaving is the process in which you subject an item you wish to decontaminate, halimbawa, for at least 15 minutes under 121 degree pressure. Degree Celsius pressure ba? O degree pressure lang. So, ayun. So, yun yung through research, yun yung nalaman ng mga scientists na optimal pressure na ma-ensure na patay din pati yung spores ng bacteria natin and fungi. So, Bacillus anthracis can also last longer in alkaline soils. So, kayo guys, pagdating nyo ng third year, may balita na ba kayo sa face-to-face? Sorry, nakising ito. May balita na ba? Wala pa? Since nakipag-meeting ata, sige, bukas tanong ko sa B kung anong balita. Pero, hirap, no? Pero, third year, sigurado mag-face-to-face na kayo. Hopefully. Sigurado na sana yun. So, you will use, the autoclave natin. So, masaya actually naglalab sa micro since routine procedures and kapag sanay ka na parang na lang, clockwork and masaya talaga. Tapos hintayin mo lang ma-decontaminate tapos pour ka na ng agar tapos drawing ka na ng inoculum mo sa sa agar para sa wool Surter's disease. Yeah. We will actually talk about. Yan, familiar na yung isa niyong kaklase. So, wool Surter's disease. So, in ruminants, the diseases, the disease is septicemic and highly fatal. So, most animals can be seen without any early signs of the disease. So, possible na sudden death ang makita ng farmer sa mga ruminants siya. Bigla na lang patay and bloated sila. So, possible anthrax na yun. So, post-mortem findings include rapid bloating. So, mapapansin niyo sa picture, bloated yung animal mo. Incomplete rigor mortis, hemorrhage, and edema. So, nagkakaroon ng blood discharge, and fluid accumulation within the body. And dark, unclotted blood. So, an extremely large spleen is also observed. So, though if ikaw yan, suspected mo ng anthrax, hindi mo na titignan yung spleen. Because carcass of suspected anthrax cases must not be opened as it will facilitate sporulation. So, this is actually an actual anthrax case sa isang article na nakita ko online. So, ito yung bungad. The next day sa farmer, when their cattle appear normal the day prior. So, nakita mo, bigla na lang silang bloated yung mga cattle niya. So, wag mo nang i-open. Kasi when you open up the cattle, since anthrax yan, yung mga bacteria, yung spores na marirelease lang sa air. Which you can be infected with. Or you can also carry the disease when you go home after your necropsy procedure. So, wag mo nang open. Ang maganda is ibaon mo ng malalim sa lupa or sunugin mo muna tapos ibaon mo. No? So, though we can treat this if suspected sa early period of the disease. So, high doses of penicillin G and oxytetracycline can be given to the animals. Nandito na ba siya? And so, nandito na si Doc Lyle Lugay. So, gawin kitang co-host. So, wait lang, Doc. Tapusin ko na to. So, hindi. I doubt anthrax. May nagtanong, anthrax din po ba yung nangyayari sa mga whales na nawawash up sa shore? Yung lumolobo po? I'm guessing not. Feel ko doon sa mga cases na yon, natural na rigor mortis na lang nung na-wash up na sila papunta sa may vaccine dito. Hindi ko nalagay na. Wait lang. May vaccine. Doc Lyle. Doc Lyle.
Yes, Doc.
May vaccine ba for anthrax?
Ano, Doc?
May vaccine ba for anthrax?
I doubt wala, Doc. Wala.
I forgot na. Sorry. So, yun. So, bagay. Usually, lalagay ko naman dito sa PowerPoint kung meron. So, kung ganito, mas maganda, wag na lang wag kayong lumapit or lalapit man, make sure you are super protected from the So, if kayo, may doubt kayo nun, you can drink antibiotics. O yun, may nag-search. So yun, may nag-search. So there is one anthrax vaccine license for use in the United States. So sa US, meron pa lang isang vaccine for anthrax. So that's new to me. So Biotrax daw ang tawag. So thank you for searching. Ang cute pa naman ng profile pic, though meron na tayong food shortage sa manok ngayon. So yun, meron pa lang isang vaccine sa US. So actually, sa mga viral diseases, some of the vaccines are only available sa other countries and hindi pa sila approved dito sa Pilipinas or tinetesting sa other countries and hindi pa sila i-ready to market worldwide. So, yun. So, ito yung na-mention kanina sa yung classmates nagtanong kung wool sorters disease ba ang tao sa anthrax. So, humans infected with anthrax can exhibit 3 forms. Cutaneous, ito, malignant pustules, pulmonary, wool sorters disease, and intestinal. So, signs are related kung saan siya nag-originate. Cutaneous, ito, ang mangyayari, magkakaroon ng growth of a pustule sa bala ng tao. So, I think there's hindi gaano mataas mortality rate sa humans. So, pulmonary naman, wool sorters disease, of course, related sa breathing. Magkaroon ng dyspnea ang tao. Anoxia, possible sa wool sorters disease. And the intestinal, diarrhea, makikita natin na clinical signs. So, ito, si tetanus. Ang ulit-ulit ko nang minimension the past few lessons. So, tetanus, it is caused by Clostridium tetani, another gram-positive bacteria which also spore-producing. So it is an acute, potentially fatal intoxication which affects many species. So horses and man are highly susceptible to tetanus. Ruminants and pigs are moderately susceptible, while carnivores are comparatively resistant. So, though meron na, kung nakita nyo sa Facebook, merong isang case ng cat ng karoon ng tetanus. So, though they are relatively resistant, hindi pa rin sila lahat. Hindi naman lahat ng pusa hindi magkakaroon ng tetanus. So, talagang magkakaroon ng ganito. Spasm yung paa para hindi na makagalaw yung kabayang yan kapag na ganito na. Ganyan siya, matagal. Since muscle spasm, walang non-stop. So clinical signs include stiffness, spasms, altered respiratory and heart rate, nahirapang lumunok, and altered facial expression. Makita natin sa tetanus. So, yung heart mag-overwork since alam ko non-stop supply of calcium deposits ata or something. So, mag-overwork yung heart mo. Usually sa tetanus, ang one way of their death is yung heart nila bibigay na. Di na kaya dahil sa overwork. So, antitoxin should be given promptly intravenous for 3 consecutive days. So, toxide naman may be given subcutaneously to promote an active immune response. So, large doses of penicillin may be given intramuscularly to kill the bacteria, and surgical debridement o paglinis sa wound or removal of foreign bodies followed by flushing with hydrogen peroxide helps inhibit bacterial replication at the site. So if kayo guys, nagkaroon kayo ng deep wound, since yun yung kailangan ng environment ng bacteria, an anaerobic condition, walang oxygen, since deep yung wound mo, konting oxygen makakapasok. So, magandang gawin is pakalinisan nyo yung wound area nyo, no? So, kahit anong disease naman yan, nakagat ka ng aso, di ba? Unang recommend ng doctor sa inyo is pakalinisin nyo yung bite area. Since possible na ma-wash out mo yung causative agent, yung virus. At the same time, kapag nakagat ka or may nakapasok na pako sa'yo, let's say hindi man siya rusty, nakapasok pa rin, there's a chance na doon na mag-develop yung tetanus bacteria. So next is tuberculosis. So this is also the lungs. You can see the nodules forming in the lungs. So tuberculosis in cattle is caused by Mycobacterium bovis, an acid-fast bacteria. So hindi sila nag-i-stain sa gram staining. So due to their high lipid and mycolytic acid of their cell walls, so hindi possible ang gram staining sa mga Mycobacterium bacteria. So nag-aano na tayo ng acid-fast staining ang ginagawa naman natin, which they will appear this color. If colorblind kayo, they appear dark magenta, parang dark magenta to, in the microscope. So clinical signs of tuberculosis are only evident in advanced cases. So kapag malala na, doon mo palang makikita yung clinical signs of tuberculosis. So we have development of coughing and intermittent pyrexia. So pabalik-balik yung lagnat ng animal mo. So treatment is not recommended since malala na nga kapag makikita mo yung clinical signs. So test and slaughter policy is more ideal in tuberculosis cases. So tuberculin test is the standard antemortem test in cattle. So antemortem, buhay pa yung cattle dito ha. So postmortem, patay na yung animal. Antemortem, buhay pa kapag titest mo. So insert 0.1 ml of tuberculin in the tail of the animal. So after 72 hours or 3 days, kapag nagkaroon ng swelling sa tail ng cattle, ibig sabihin positive sa tuberculosis. Merong may tuberculosis pero hindi to yung species. So I decided na since mas common to sa cattle, ito na lang ilinagay. Yung cattle na lang yung linagay ko. So you will tackle more mycobacterium species as you go along in your year. So one genus, one disease lang ako today. So though meron sa other animals. So yun. So after 3 days, kapag nag-swell, positive. So kapag nakita mo na nag-swell yung tail ng cattle, ikal mo na. Kahit wala pa siyang clinical signs. Kung suspected mong, yung katabing farm ko nagkaroon ng tuberculosis, test ko kayo sa akin. So mag-tuberculin test ka, insert tuberculin. So after 72 hours, na maga yung tail, ikal mo na yung cattle mo since positive sila sa tuberculosis. So next is enteric coli bacillosis. So diarrhea. So enteric coli bacillosis is caused by Escherichia coli, a rod-shaped gram-negative bacteria. So gram-negative naman tayo. So it primarily affects newborn calves, lambs, and piglets. And the bacteria produces enterotoxin which stimulates hypersecretory diarrhea. So very active ang pag-secrete ng GI tract ng fluids and waste materials para ilabas ng animal in the form of diarrhea. So depression becomes marked, and since hypersecretory diarrhea nangyari, magkakaroon ng dehydration yung animal and acidosis. So since naubusan ng fluids yung animal, hindi ganong nababuffer yung acids. So, nagkakaroon ng acidosis. So, yan. Tayo rin naman kapag nagsusuka, di ba kapag food poisoning, one threat sa food poisoning is dehydration. Kaya ina-IV fluids yung mga na-food poison paminsan due to non-stop vomiting and diarrhea nila. So, yan din sa animals. Possible din sila ma-dehydrate through diarrhea. So, newborn animals should receive an ample amount of colostrum shortly after birth. And if diarrhea develops, milk should be replaced with fluids with electrolytes. Para lang makabawi, hindi ma-dehydrate ng todo yung animal mo. So next is pullorum disease. So pullorum disease, bacillary white diarrhea. Tama. So caused by Salmonella pullorum. So mapapansin niyo, Salmonella pullorum is not, yung pullorum, hindi siya naka-lowercase, hindi rin siya naka-italicized. So it is actually a subtype. Subtype ba? Doctor, sorry, I forgot the term. Familiar ka pa ba sa anong term natin dito?
Hindi na, Doc.
Sorry, fourth year pa kasi ito. Pero this is, hindi siya species. So Salmonella bacteria meron silang certain antigen. So meron silang certain part of their cell na pang-differentiate sa kanila sa other bacteria. So this is a subtype, not a species of the Salmonella. So, sa Salmonella, makikita nyo, I think sa next disease ko, Salmonella ulit. Hindi rin siya species, subtype siya ng Salmonella. So, ganito yung pagsulat natin. Naka-capital to and hindi sila naka-italicize. So, it infects chicks and poults after 3 weeks of age. So, affected birds huddle on a heat source. So, they will appear anorexic, depressed, and have whitish fecal pasting around their vents. That's why the other name of the disease is bacillary white diarrhea, because of the whitish fecal pasting around their vents. So whitish nodes throughout the lungs and the heart, itong mga nodes na to. And focal necrosis of the liver and spleen are characteristic in the disease. So, yan yung sa bacillary white diarrhea. So, foul typhoid naman, it is caused by Salmonella gallinarum. So, it is the causative agent of the disease and it can produce lesions, same with polorum disease. So, ang difference lang, sa foul typhoid, pwede kang makakita ng septicemic disease in adult birds. That can develop with sudden death as its main indication. So, a bile-stained and enlarged liver and spleen can also be observed in foul typhoid. Ito. So, liver and spleen. Antibiotic susceptibility test must first be done to be able to give the appropriate treatment for both the disease caused by Salmonella mentioned in this discussion. So if familiar kayo sa antibiotic susceptibility test, yung merong petri dish, magkakat tayo ng filter paper, tapos isusok natin yung filter paper na yon sa different antibiotics. Tapos, dun sa plate mo dapat, i-incorporate mo yung bacteria. So, may picture ba ako? Wala. So, halimbawa, imagine a petri dish. Tapos, nag-grow halimbawa yung bacteria sa petri dish na yun, no? So, maglagay ka ng filter papers with na meron ng antibiotic na nakasok sa kanila sa nakapaikot. So, imagine 6 small circles within the petri dish, evenly spaced. Tapos, hayaan mo mag-grow in at least a day. So, pagkuha mo sa incubator, tignan mo yung petri dish. Kapag titignan mo alin sa mga filter paper na yon yung may pinaka maraming space, pinaka mahabang space na na-clear out, yun yung pinaka-effective treatment nun. So, i-search nyo man sa Google Image Antibiotic Sensitivity Test. So, para mas ma-appreciate nyo. Or di ko nalagay dito. So, yun. Next is glanders. So glanders is caused by Burkholderia mallee, a medium-sized gram-negative rod. So it is a contagious disease in horses characterized by formation of nodules and ulcers on the respiratory tract and the skin. So ito makikita nyo nagkakaroon ng ulceration sa mouth area ng horse na to. So a purulent and blood-stained nasal discharge can sometimes be observed. Ito. Blood-stained nasal discharge. So, maline test can be performed to confirm diagnosis. So, we inject 0.1 ml of maline. I think this is a protein specific for Burkholderia mallee in the lower eyelid and will result in swelling and ocular discharge after 24 hours in positive cases. So, parang same siya ng concept sa sa tuberculin test. So, dito naman, instead sa tail, below the eyelid tayo mag-i-inject. And if nag-swell, positive daw yung animal sa glanders. So, test and slaughter policy is enforced in detected cases. And antibiotic therapy is not recommended as recovered animals serve as subclinical carriers of the disease. So, kahit mag-recover na yung animal, nandyan pa rin yung bacteria. So, instead na i-keep mo pa sila, okay. So, instead na i-keep mo pa sila, mas magandang ialis mo na sa farm mo kasi they will still continue to serve as transmitters of the disease. So, actinobacillosis naman. So, papansin nyo, this is the SI, small n. I think this is the intestine. Oh, and then, no. Tongue. Diyos ko. Yun yung problem. Few months ago ko pang ginawa to. So this is the tongue. So magkakaroon ng ulceration. O nga no, wooden tongue pala to. So actinobacillus. So it is caused by Actinobacillus lignieresi. Nakalimutan ko. So actinobacillosis, giveaway yung name ng causative agent, Actinobacillus. So Actinobacillus lignieresi is a gram-negative bacteria, and most often sign is induration of the tongue in cattle. So this symptom is called timber or wooden tongue. So cases are usually sporadic through affected animals, and they experience difficulty in eating and drooling of saliva. So hindi nila magalaw ang tongue nila, nanigas, parang wood. So tas magkakaroon ng ulceration. So most likely masakit. Yan, of course. So treatment is sodium iodide parenterally or potassium iodide orally. So parenterally, ito yung hindi orally. Yun nga, no, yun yung tamang term. So, alam ko kasi parenterally, when they say parenteral, any site na hindi oral.
Yes, Doc.
Yes. So, pwedeng intramuscularly, intravenously, so things like that. So sulfonamides or pen strep are also effective for the disease. So at patapos na yan tayo, guys. So sorry, umaba na 15 minutes. Fowl cholera. So I don't know if common pa to sa farms. So though we have I think we have bacteriums for this. So fowl cholera is caused by Pasteurella multocida type A. So malalaman nyo sino type B, C, D, E. So pag fourth year na kayo, pag muna ngayon. So Pasteurella multocida type A causes fowl cholera. It is also a gram-negative bacteria. So it is highly contagious and affects both wild and domesticated birds. Though turkeys are more susceptible than chickens. So ano bang makikita natin sa fowl cholera? So magkakaroon ng hemorrhage, accumulation of body fluids, and septicemia are the common signs of the disease. So the wattles are usually swollen with exudates or may lumalabas na fluids. Ito, swollen si wattle ng manok na to. So anong treatment natin for fowl cholera? Sulfonamides or tetracyclines on food and water. So usually naman sa mga manok, ang treatment natin or pati vaccines, ino-incorporate na sa tubig. Kasi very unideal. Halimbawa, big scale farm ka, more than, medium na lang, 10,000 plus chickens mo. Ideal bang isa-isahin mong i-treat na yun? Halimbawa, injectable yung treatment. So that's not practical in the field. So our current treatment for large scale farming, usually pwede na sila for spray or ilagay na sa food and water. So next is Glasser's disease. This is present in the Philippines. I am sure with that kasi nung nag-dissect kami ng baboy ni na Doc Aris sa class namin sa pathology, ang nakuha naming baboy sa farm is merong ganito. Glasser's disease. So Glasser's disease is caused by Haemophilus parasuis. So pasensya guys, ang daming scientific names that you need to memorize. But that's part of the job of being a veterinarian. So Haemophilus parasuis is a small, hindi ko nakulayan to, gram-negative rod, and it needs growth factors present in chocolate agar before it can grow in the laboratory. So ano ba yung chocolate agar? So huwag niyong isiping maglalagay tayo ng chocolate dyan. This is actually an blood agar na linuto natin. Kukuha tayo ng sheep blood and i-heat natin para mag-brown. Mukha siyang chocolate. Wala akong picture. So if sa search naman chocolate agar, ganun siya. So isipin mo kainin nun yun. Pero yun. So some bacteria need the growth factors present in some agars to be able to grow. And some agars, like na-mention ko last time sa E. coli, they inhibit the growth of other bacteria to allow the growth of the bacteria na kailangan mong i-isolate. So, anorexia, pyrexia, di makakain, may lagnat, hindi makatayo, and nagkakonvulse ang animal kapag meron siyang Glasser's disease. And cyanosis of the ear can also be seen. So cyanosis is most likely kulang ng blood or oxygen supply. So yung mga extremities, nagda-darken ng color. So tayo kapag, di ba kapag tinakpan mo ng maigi yung daliri mo, magpa-purple siya. So parang ganun din sa baboy. Pero sa tenga naman nila. So that can occur without any clinical signs. So fibrinous polycerasitis, ito mga to. Infectious polyarthritis. No. Ito, I think this is, sabi ni Doc Aris, this is fibrinous polycerasitis is distinct sa pigs affected by Glasser's disease. Nung nag-ano kami. So, ito, yung mga ito, yung mga yan. So, yung whitish. So, treatment is penicillin, tetracycline, and sulfonamides can be used. So, wala akong picture nung inano namin, yung ino-open up namin na baboy. Since di uso sa akin nag-picture ng video nun. Pero parang ganito din yung nakita namin. May whitish layer pa pag open namin, which is not normal daw. So, yun yung ano namin sa Glassers. Next is infectious coryza. Infectious coryza is caused by Avibacterium paragalinarum, another gram-negative bacteria that affects the upper respiratory tract and paranasal sinuses of chickens. So ano makikita natin sa infectious coryza? So depression, facial swelling, as you can see with this chicken, serous nasal discharge, as you can also see with this chicken, can be seen. So in layers naman, bababa ang egg production ng mga layer chicken natin. So anong treatment natin? In case makita natin to sa farm, instead of culling, we can try treatment muna. Oxytetracycline and erythromycin can be used. So, and there are a lot of pathogenic bacteria in the veterinary field. So you will encounter more bacterial diseases on your other animal science, micro and medicine subjects. So, yun. Any questions regarding bacterial diseases? So those are some of the bacterial diseases na common sa field natin. So if wala kayong questions, if nahiya kayo, chat na lang. So I will now give the Zoom floor to Doc Sheldon Lyle Dugay, one of the graduating students of the College of Veterinary Medicine. So currently his thesis is focused on laboratory research in mice using a plant extract na spray dried. So, Doc Lyle, if may gusto ko pang introduce sa sarili mo, the floor is yours.
Parang in-introduce mo talaga ako. Ayan. Good afternoon, guys. Ang dami nyo, 58, ay 57. So, 1A to Doc, no?
Oh, 1A.
1A, okay. So, for today, i-discuss, Doc, naka-share na ba?
Wala pa.
Ayan, Doc.
Wait, naglo-loading. Ayan.
Ayan, Doc.
Yes.
So, good morning, class. Ay, good afternoon, class. So, ayun nga, pinakilala na ako ni Doc James. I'm Sheldon Lyle M. Dugay, 6th-year vet med student, graduating sana. So, yun, katulad nga ng sinabi ni Doc James na nagtitisis ako ngayon about sa laboratory mice. So, yun. Then, for today, papasadahin natin yung mga common parasitic infections or infestations or diseases sa mga domestic animals. Alam ko naman, madami nang diniscuss si Doc ngayon. So, konti na lang yung mga in-incorporate ko na mga parasitic diseases. Yung mga importante lang, tsaka yung mga pinaka-common dito sa Pilipinas. And then, Doc, I'm sorry, di ko ata na-incorporate yung mga treatments.
Sige. Okay lang.
Kasi, akala, di naman GMed, di ba?
O ano, mas magandang
AS,
hindi na problemahin
AS100.
ng mga students mo na
Oo,
yun.
wag na muna. Anyway, kung kailangan nila doc, pwede ko naman ilagay dito sa PowerPoint.
Oo, sige. Para mas madami silang ma-review sa exam.
Oo. Yan. So, let's start. So, let's start with the meaning of parasite. So, a parasite is an organism that lives in or on. Kapag sinabing in, may mga parasites kasi na nabubuhay sa loob ng katawan ng isang animal, meron din sa labas. So, itong mga parasite na to, kinukuha nila yung mga nourishment, mga nutrients, tapos nagbibigay sila ng harmful effects sa mga host nila or sa isa pang organism. And then parasites of animals and humans come in many forms. Kasama dito yung mga helminths or ito yung mga worms, mga roundworms, flatworms, tapeworms, tsaka mga flukes, mga ganun. Tapos sa arthropods naman, ito yung natin. Ito yung mga ticks, fleas, mga flies, mga mites, and mosquitoes. Tapos kung natatandaan nyo sa zoology din ninyo, yung protozoa, which is a single nucleated cells na eukaryotes, kasama dito yung mga coccidia, trypanosoma, mga amoeba, mga giardia, mga ganon. So, ngayon, i-define natin yung mga basic terminologies na ma-encounter natin for today's lesson. And yung first is endoparasites. So, these are parasites that live within the body. Kapag sinabing endo, which means inside, it means nasa loob ng katawan ng isang animal yung isang parasite. So, kapag dumami yon sa loob ng isang katawan ng animal, tinatawag natin yun na infections. Kapag ectoparasites naman, which from the word ecto or sa labas, nasa labas yung mga parasites. So, tinatawag natin yun na infestations. So, huwag kayong papalito doon. Kapag sinabing endoparasites, infections. Kapag ectoparasites naman, infestations. Ngayon, ang sabi dito is, yung ectoparasites daw, these are parasites that live on the external surfaces of the host or inside the skin. So, parang mako-consider natin siya na endoparasites. Pero mali. Kasi may mga ectoparasites na kayang mag-burrow or kumutkot sa ilalim ng puting. Joke lang. Ang corny. Sa ilalim ng skin. So, mga tinatamaan niya doon is yung mga vessels, mga sebaceous glands, mga sweat glands, mga ganun, pati yung mga hairs. So, yun. And then, other terms, definitive host or yung pinaka-final host. Example nito is, for example, yung kahit sa COVID na lang, for example, parasite yung COVID, tayo yung final host kasi tayo yung ini-infect niya, parang ganun. Tapos sa intermediate host naman, these are hosts in which there is required development of intermediate or larval stages. Kung familiar kayo sa heartworm disease, which is maano natin mamaya ma-discuss, yung heartworm disease kasi is kailangan niya munang pumunta sa parang natatransmit siya through mosquitoes. So kapag yung isang mosquito na infected ng heartworm, pwede niya ma-transmit yun sa isang aso, parang ganun. So yung mosquito na yun yung magiging intermediate host ng heartworm eggs or mga larvae, parang ganun. And then other terms, yung mechanical vector, ito yung mga nagtatransmit ng causative agent na mga materials, like for example, mga shoes, mga ganyan, mga syringe, basta kahit anong bagay na pwedeng magsilbing na pwedeng maging aid for the transmission of the parasite. Sa mga biological vector din naman, mga living organisms na pwede mag-transmit. For example, mga ticks, pwede sila mag-transmit ng ibang bacteria, mga ibang protozoa, mga ganon, mga ibang parasites din. Then punta tayo sa mga common parasitic diseases ng mga dogs. In-incorporate ko din yata yung mga parasitic diseases ng mga cats dito. So, Sarcoptic mange. So kung may mga aso kayo or may mga pusa, ito yung pinaka-common na skin disease ng mga dogs and cats. So sarcoptic mange is a highly contagious skin disease of dogs found worldwide, causing intense pruritus or itchiness and papulocrustus eruptions. So ang meaning nito is sobra-sobra yung pangangate ng mga aso kasi grabe yung irritation kapag may sarcoptic species tayo sa isang animal. So yung pag-scratch niya, nagkakaroon to ng eruptions, tapos nagkakabiyak-biyak yung mga skin nila. And then yung causative agent is Sarcoptes cabiae var canis. And then sa cats naman, ito yung Notoedres cati. Tapos tinatawag siya as Notoedric mange. Ito na yung disease. So ganyan yung itsura ng garapata. Ay, hindi. Oo. Yan, yung Sarcoptes cabiae var canis. Then, mga clinical signs niya is intense pruritus nga, and yun yung pinaka-characteristic niya. Tapos primary lesions consist of papulocrustus eruptions with thick yellow crustus excoriations, erythema, and alopecia. So, ano ba to? Yun. Yung eruptions, nagkakaroon ng nagiging thick siya kasi kumakapal. So, kasi nagkakaroon ng keratinization ng skin. So, yun yung dahilan kung bakit nangangapal siya. Tapos nagkakaroon din ng erythema or parang nagiging reddish yung area, parang ganun. Tapos kapag may sarcoptic mange or may sarcoptes na infestation, nagkakaroon din ng yung dog or cats ng secondary bacterial infections kasi mahina yung immune system nila, pati yung nagkakaroon din sila ng yeast infections. So, ayan. Ayan yung mga example ng mga pictures ng isang may sarcoptic mange na aso. Tapos, very, very common ito sa mga, mga aspin na napapabayaan sa daan. Parang, yun, mas madali nilang makuha yun kasi kahit kung saan sila pumupunta. Then another one is demodectic mange. Ang cause naman nito is ang other name naman nito is canine demodicosis. So it is a severe disease of young dogs with generalized lesions that are usually aggravated by secondary bacterial infections also. Tapos ito yung causative agent, Demodex canis. So yung kanina parang pabilog yung yung sarcoptes, ito namang Demodex, siya, pahaba. So madali silang ma-determine. Kung mag-skin test kayo, ito yung ganito yung makikita nyo. Maano nyo sila, di-differentiate nyo sila kaagad. Kasi halos same yung lesions ng sarcoptic at ng demodectic mange. So baka malito kayo. So para tama yung diagnosis nyo, magpa-perform kayo ng skin test, mag-scrape kayo ng skin, tapos titignan under microscope, ganyan yung makikita. And then yung mga lesions niya is often consists of 1 to 5 well-demarcated small areas of alopecia, erythema, and scaling. Lesions are usually confined to areas around the lips, periorbital area, and forelimbs, but may be found in other locations. Pruritus is usually absent or mild. And then yung pododermatitis is very common. May picture ata ako dito. So ayan, sabi niya magsisimula sa chest area or dito sa limb. Tapos aakyat yan sa head. Tapos kung makikita niyo tong yung paa niya, parang yun nga, nagkakaroon ng alopecia or hair loss. Tapos keratinized din yung kasi nangangapal na yung skin, and then may may inflammation. Yung tawag dito is pododermatitis, this one. And then next, ear mite infestation. Ear mites are a common cause of ear disease and infection, although other ear conditions may cause similar clinical signs such as yung mga immune-mediated na mga diseases or mga fungal diseases, pwede mo silang maging differential diagnosis. So, careful na lang doon. Infestations are a very common problem in puppies and kittens, although pets of any age can be affected. So, yung causative agent is Otodectes cyanotis. Kung makikita nyo, ito medyo mas pahaba siya kaysa dun sa sarcoptic na species. Ayan. Tapos, clinical signs, ear irritation, of course, leading to scratching and the ears or head shaking. Kapag sobra na yung scratching, nagkakaroon na ng bleeding yung ears. Tapos sobrang na dumadami yung wax and crusty na yung discharge sa ear nila. Tapos nagkakaroon din ng areas of hair loss resulting from self-trauma. Kasi nga, nag-head shaking sila tapos ini-scratch pa nila. So, nagkakaroon ng self-trauma. Tapos, yung oral hematoma naman, ito yung, kapag sinabing oral, itong A-U-R-A-L, ang meaning niyan is, pinapertain niya yung ears. Tapos, kapag sinabing hematoma, yung nag-clot na dugo. So, kapag pinagsama mo yung words na yon, yung nag-clot na dugo sa ears. So, very common ito sa ear mite infestation kasi nga nagkakaroon ng self-trauma. Ayan yung another picture ng Otodectes. Tapos ayan, kung makikita nyo, sobrang waxy tapos hanggang sa labas, which is dapat hanggang dito lang sa loob yan. Yun. Ito pa, may namumuong mga wax din. So kung mag-skin test ka or ear swab, kukuha ka dyan tapos i-oil immersion mo, tapos titignan mo sa microscope, makikita mo yung mga gantong appearance. And then another is heartworm disease. Ito worm na to. So heartworm disease is a serious disease that results in severe lung disease, heart failure, or other organ damage and death in pets, mainly dogs, cats, and ferrets. So yung causative agent niya is Dirophilaria immitis. Tapos yung intermediate host niya or yung nagtatransmit ng disease na ito is yung mosquitoes. May mga certain species na ng mosquitoes na nagtatransmit ng Dirophilaria immitis. So, ma-encounter nyo na lang yun sa veterinary pathology sa higher years. So, ito yung this picture, siya, blood smear siya. Tapos, ito yung mga red blood cells. Kung makikita nyo, ruptured, ganun. Kasi nga may nagkakaroon ng trauma dun sa mga cells dahil dito sa worm na to. So, makikita mo siya sa blood. And then, yung clinical signs niya is cough, exercise intolerance, cyanosis. Exercise intolerance kasi napupunta din tong worm na to sa lungs. So, kung obstructed yung lungs niya, nahihirapan din siyang huminga. So, hindi niya kaya yung mga extraneous exercise na dati niyang ginagawa. Tapos, cyanosis naman, cyanosis kasi, or ano kasing cyanosis? Cyanosis. Pagiging blue or parang bluish yung skin, parang ganon. Kasi nagkakaroon ng decreased supply ng oxygen sa mga different areas ng body. So nagkakaroon ng ganon kasi obstructed din yung heart. Kasi may mga worms sa heart niya. So this niya, nahirapan din huminga. Tapos hemoptysis or coughing with blood. Tapos syncope, tapos collapse, and nagkakaroon din ng ascites kasi yung mostly yung heart failure is sa right side. So expect na natin na magkakaroon ng ascites or mga fluid sa sa abdominal area. And then other clinical signs, live adult heartworms cause direct mechanical trauma to heart and lungs. Then this damages vessel intima, leading to proliferative endarteritis or inflammation sa inside ng artery, and perivascular coughing with inflammatory cells, including infiltration of high numbers of eosinophils. Tumataas yung eosinophils kasi expect na natin to sa mga parasitic infections. Kapag nag-check kayo ng CDC, expect nyong tataas yung eosinophils kapag suspected nyo na parasitic yung infection or infestation. And then, ayan, ganyan yung example. So, ito yung heartworm na nag-lodge sa heart, sa ventricles ng heart. So, kung nandyan yan, tapos, syempre, mahihirapan mag-pump ng blood yung heart. So, ma-decrease yung supply ng nutrients, ng oxygen sa different parts of the body of the animal. And then other pictures, ayan, ganyan sila kahaba. Tapos usually, yung iba sa other countries, ginagawa nila is kapag hindi na kaya yung deworm, mag-i-incise sila sa vena cava para may access sila sa heart. Tapos, ayan, kukunin nila yung mga gamit itong tube na to, at saka yung mga parang pang-hook nila yung mga worms sa heart. Then next, toxocariasis is a parasitic infection of Toxocara roundworms that commonly found in puppies. Puppies are usually pot-bellied. So, madalas sa mga puppies kapag nakita natin na malaki yung tiyan or yung tinatawag nating bulat tiyan sa Kapampangan, suspected yon for toxocariasis kasi malalaki yung mga worms na to. So, kapag dumami sila, lalaki talaga yung tiyan. So, yung causative agent is Toxocara canis sa mga puppies yon. Tapos in older dogs, iba yung nagko-cause. Or pwede din mag-cause yung canis, pero pinaka-common na nagko-cause sa mga older dogs is Toxoscaris leonina. So, ito yung eggs, makikita yan sa feces, and then ito yung adult na worm, roundworm. Saan yun? Ayan. Clinical signs, the first indication of infection in young animals is lack of growth and loss of condition. Infected animals have a dull coat and often are pot-bellied, katulad ng sinabi ko kanina. Worms may be vomited in, ano lang yun, mga konti lang yung mga cases na nabavomit nila yung mga worms ng Toxocara, and are often voided in the feces. Ito yung pinaka-common. Sa feces talaga sila lumalabas. In the early stages, migrating larvae may cause eosinophilic pneumonia, which can be associated with coughing, and diarrhea with mucus may be evident. Ayan, ito yung pot belly na sinasabi ko. So, makikita natin, sobrang laki nung tiyan, tapos puppy siya. So, kung hindi siya na-deworm, kung hindi regular yung deworming, hindi updated yung deworming niya, ng isang puppy, most likely magkakaroon sila ng ganito kasi yung mga Toxocara normally nasa ano natin yan sa tiyan, ay nasa tiyan ng aso. So kapag hindi sila na-deworm, nagiging opportunistic sila, so dumadami sila. So ito naman yung picture ng feces ng isang dog na may Toxocara infection or toxocariasis. And then diplegium infection is an intestinal tapeworm infection in dogs that usually transmitted by fleas. So yung causative agent is Diplegium caninum. Ito yung ganito yung itsura ng eggs, tapos ganito yung adult. So kapag nasa intestine sila, pwedeng, dahil segmented itong worm na to, pwede yan mag-detach. Tapos yung kadalasan may mga eggs yan, so kahit kapag naano yan sa feces, pwedeng makain ng ibang animals. Tapos yon, yung intermediate host niya is biting lice and fleas. Ayan, ito yung biting louse. or lice. Tapos ito naman yung fleas. Then clinical signs, adult tapeworm infections. Adult tapeworm infections cause little harm or inconvenience to dogs and cats. Sometimes affected dogs may scoot their bottoms along the ground. So yung sinasabi ko kanina na dahil segmented ito, pwedeng magstay sa perineal area nila or yung sa anus area. So dahil ito kasi parang nagko-cause siya ng irritation. So kapag irritated yung anal area or yung perineal area nila, nag-scoot sila. Ayan, ganyan yung itsura. So kung makikita nyo na gumaganyan yung aso ninyo, suspected na may diplegium infection sila. So next is ancylostoma infection, an intestinal hookworm infection that can cause diarrhea and anemia in dogs. So kung makikita nyo, ito yung mouth niya. So parang may hook siya or mga ngipin. Ayan. So yung causative agent niya is ancylostoma canine. Ito yung eggs. Tapos ito yung parang mouth niya. And then ganito siya kapag nasa intestine. Then ancylostoma infection, clinical signs. An acute anemia in young puppies is the characteristic and often fatal and clinical manifestation of a ancylostoma caninum infection. So nagkakaroon ng anemia because kung makikita niyo yung mga ngipin niya, ito yung ginagamit niya para pang-suck ng blood sa intestine. So kung continuous yung pagsak nila ng blood, tapos heavily infected siya, madami yung mga ancylostoma dun sa intestinal tract niya. So maano mo na may anemia siya. Ayan. Tapos nagkakaroon din ng diarrhea with dark tarry feces accompanies severe infection. So dahil sa ito kasi nasa small intestine mostly, kaya kapag kapag nag-bleed yung small intestine, pagdating niya sa feces, dark na siya. Kaya nagiging dark yung diarrhea. Ayan, diarrhea with dark tarry feces. 'Di ba commonly normally red yung blood. So kapag sa intestine yung bleeding, magiging dark yung feces. Kapag sa large intestine naman, which is close to the rectum or close to the anus, magiging red yung magiging feces niya. Then surviving puppies develop some immunity and show less severe clinical signs. And then next is babesiosis, very common na blood parasite sa mga dogs. So babesiosis is a disease transmitted by ticks. It is caused by a protozoan parasite. Caused by protozoan parasites of the genus Babesia, which infect the red blood cells. So the causative agent is Babesia canis. Ito yung pinaka-common. Pero pwede din ma-infect ng Babesia vogeli, Babesia rossi, and sa cats naman, Babesia felis. So sa blood smear, ganito yung itsura niya. Itong dalawa. So ito yung red blood cell. So papasok sila dyan para kumuha ng mga nutrients, tapos magiging ruptured yung red blood cells. Other pictures, ito sila. So kung makikita nyo, hindi na normal yung structure ng mga red blood cells. Normally may may pale yung sa gitna. Tapos ayan, heavily infected siya kasi sa isang film may numerous na makikitang Babesia species. Then yung vector niya or yung biological vector or intermediate host niya is ticks. Ito yung mga Dermacentor reticularis, Rhipicephalus sanguineus, and Hemaphysalis elliptica. So dahil nasa tropical and subtropical countries tayo, yung pinaka-common sa atin is yung Rhipicephalus sanguineus. So ito siya. So kapag larva, ganyan ganyan sila kaliit. Tapos kapag nymph, ganyan, lalaki na yan hanggang maging ganito sila. So itong adult female, ito yung mga blood sucking. Sila kasi yung nag-carry ng egg. So kailangan nila ng nutrients. So sila yung madalas nating nakikita na nag-engorge. Ayan, ganyan yung itsura ng mga female. So yung laman nito is blood tsaka yung eggs nila. So itong mga Rhipicephalus sanguineus nito, ito yung mga nagdadala ng Babesia species. Sila yung nagtatransmit ng Babesia dun sa mga dogs. Then clinical signs, acute babesiosis generally runs a course of 1 week or less. The first clinical signs are lethargy, weakness, depression, and fever. Inappetence, cyanosis, anemia, jaundice, and weight loss. Tapos kung magsi-CBC kayo, makikita nyo na sobrang baba ng RBC count, hematocrit, tsaka yung platelet. So kapag minsan nagkakaroon din ng epistaxis or pag the nosebleed ng mga dogs due to severe infection ng babesiosis. So next, common parasitic diseases in swine. Ascariasis. Ascariasis is the most common and widespread intestinal parasitism in pigs. So, ayan. Causative agent is Ascaris suum. Ito yung egg niya. Tapos ganito yung itsura niya kapag adult. Clinical signs, the worms compete with the host for nutrition. Kaya makikita natin na nagkakaroon sila ng weight loss kasi dahil nakikipag-agawan ng nutrition yung mga worms, walang konti na lang yung napupuntang nutrition sa dun sa pig. So nagkakaroon sila ng weight loss, tapos bumababa yung feed conversion rate and slower yung weight gains nila. Adult worms of Ascaris suum may appreciably decrease the growth rate of young pigs, and in heavy infection, the worms may cause mechanical obstruction of the intestine. Then other clinical signs, migration through the lungs causes pulmonary lesions. So mga worms na to, pwede rin silang mag-migrate papuntang lungs. That can lead to pneumonia, particularly in animals co-infected with other viral or bacterial pathogens. Migration of larvae through the liver causes hemorrhage, fibrosis, and accumulation of lymphocytes seen as white spots. So, kung makikita nyo dito, ito yung liver ng isang pig na may ascariasis or may Ascaris suum infection. Dahil nagstay sila dito sa liver, yung iba, nagkakaroon ng fibrosis. Ayan, yung mga white na spots, kakaroon ng fibrosis. Kaya, tapos na-decrease yung efficiency or yung function ng liver. Tapos ito naman yung lung tissue section. Kapag minsan kasi napupunta sila bukod sa intestine, pumupunta sila sa lungs. Ayan. Next is trichuris infection. Causative agent is Trichuris suis. Ito yung niya, yung egg. Sa feces din to. Tapos kung makikita nyo may parang bilog sa ends. Ayan. Tapos ang tawag dito is whipworm. Kung makikita nyo para siyang latigo, yung end niya. Ayan. So madami kayong makikita ng ganito sa sa mga higher year na subjects. So trichuris infection, clinical signs. Infection is generally light with no clinical signs. Heavy infections may cause inflammatory lesions in the cecum and adjacent large intestine and may be accompanied by diarrhea and unthriftiness. Unthriftiness, parang nagiging unhealthy sila or parang hindi sila strong, parang ganun. Next, hogmange mite infestation. Causative agent is Sarcoptes cabiae suis. Ganito sila under microscope. So parang Sarcoptes cabiae siya. So wag na lang kayong palito. In veterinary parasitology subject, ma-discuss naman into details kung ano yung pinagkakaiba nila. yung bilang ng arms, yung size, yung kung gaano ka-broad yung body nila or gaano kanipis or parang ganun. Clinical signs, small red bumps or blisters appear and at first are covered with dry, bran-like scales. Later, a dark cross develops. So the skin becomes thickened, rough, and dry, and there may be considerable hair loss. So parang katulad lang din siya ng sarcoptic mange. So pero sa ano siya, sa pigs. Then other clinical signs, the intense irritation causes the pig to scratch and rub vigorously. Madalas nire-rub nila to sa mga kulungan nila. Kasi yon sa mga metal ganon, kung metal yung kulungan nila. Or kung concrete naman, pwede din nilang i-scratch doon. Tapos in advanced cases, an offensive odor may come from the lesions. The edges of active skin lesions are the best places to look for mice. So kung for example, imaginary circle, ito yung ano niya, yung part or area na infected or infested, kukuha kayo dun sa edge nung sugat or nung lesion ng sample. So coccidiosis, coccidiosis is a protozoan infection. So maraming nagkukos ng coccidiosis, mga Isospora, Eimeria, mga ganun. So for this one, sa pigs, ang nagkukos is Isospora suis and Eimeria species. So ganito yung ganito yung itsura ng Isospora suis and ganito naman yung itsura ng Eimeria species. Then clinical signs, coccidiosis is a very important disease in nursing pigs raised inside. Isospora suis occurs in nursing pigs between 5 and 15 days of age. Infected pigs usually develop a yellowish diarrhea that can become very fluid. The pigs continue to nurse yet become dehydrated and debilitated. Next, common parasitic diseases in poultry. Konti lang yata ito. So yun, Echidnophaga gallinacea. Common name niya is stick-tight flea. So, hosts of the adult fleas infest chickens, turkeys, pigeons, pheasants, quail, people, and many other mammals. So, pwede nila tayong madapuhan ng mga fleas na to. So, pero very common sila sa chickens, turkeys, and pigeons. Ayan. Clinical signs, fleas cause irritation, restlessness, and blood losses kasi nagbabite din sila or nagsasak. Then that results in anemia and death of particularly in young birds. Then next, Argus persicus. Common name is fowl tick. Ganito yung itsura niya sa microscope. Pero sobrang liit lang nila kapag nasa ayan, kung makita niyo sila. So yung clinical signs niya is it causes anemia as a result of blood loss from the ticks feeding on them at night. Causes stress and tick fever. Then magkakos siya ng mga ticks pwede silang mag-carry ng pathogens responsible for causing this disease. Then transient paralysis caused by toxins released in the tick saliva. So itong mga ticks na to nagko-cause sila ng nagre-release sila ng saliva na nagko-cause ng paralysis sa mga poultry animals. So ayan, ganyan yung itsura nila. Then next is Ascaridia galli or galay, I don't know. Ito yung pinaka-common na roundworm sa poultry animals. So kung hindi regular yung pagde-deworm or most likely magkakaroon ng ganitong infection. Ito yung egg niya. Tapos ganito yung itsura nila kapag adult. So clinical signs, these are yung young poultry are particularly susceptible to infestation by roundworms. Birds will typically develop immunity from low-level exposure by the time that they are 2 to 3 months old. So yung mga birds that are not immune and are not infested with significant numbers of roundworms become unthrifty because the damage to the intestinal lining. Kasi nga, kung nagda-damage sila ng intestinal lining, nare-reduce yung absorption ng nutrient. So, nagiging silang unhealthy, parang ganun, unthrifty sila. Tapos na-decrease din yung weight gain nila, yung feed conversion. Tapos, next is Heterachis gallinarum, commonly referred to as the sickle worm. So, I don't know kung napag-aralan nyo na sa zoology, yung sikum ng mga birds, dalawa, di ba? Ayan, yung dalawa. One. Ayan, 1, 2. So, ito yung eggs, tapos ganito yung sa microscope ng adult. Then, these worms are not believed to adversely affect performance to any degree except when they are rare severe infestations. Hindi sila nagko-cause ng ganun ka-severe na disease, pero kasi nagiging medium sila or nagiging intermediate host sila ng Histomonas meleagridis. Ito yon. So the main concern with sickle worms is that they serve as carriers of the parasite Histomonas meleagridis. Itong Histomonas meleagridis na to, i-discuss ko mamaya. Ano siya, protozoan din siya na tinatransmit ng Heterachis gallinarum. Ito yung nagkukos ng blackhead disease sa mga turkeys. Napupunta din siya sa mga chickens pero hindi siya nagkukos ng disease sa mga chickens. Yan. So ito yung Histomonas meleagridis. Yung disease name niya is Histomoniasis or blackhead disease in turkeys. So ito yung under the microscope, ganito yung itsura niya, parang nag-illuminate. Tapos, so it is a protozoan parasite of the other Trichomonadida. It is the causative agent of histomoniasis or blackhead disease, katulad ng sinabi ko. Chickens are typically asymptomatic carriers, but mortality in turkeys is commonly 80% to 100%. Then clinical signs include drooping of heads and wings, prolonged standing, closed eyes, ruffled feathers, emaciation, and sulfur-colored droppings. So, diagnosis is also based on pathognomonic ulceration of the ceca and necrotic lesions in the liver. So, ito yung example ng necrotic na liver. Ayan, parang yung sa milk spots ng Ascaris suum, no? Nagkakaroon sila ng fibrosis din sa liver. Tapos, ito yung parang dinidescribe niya kanina, yung nakababa yung feathers, ruffled yung feathers, tapos naka-close yung eyes, tapos, prolonged standing. Ayan, ganyan yung itsura nila. Tapos, ganito yung kulay, kasi nga sulfur colored daw yung feces nila kapag Histomonas meleagridis infection. Then next, ito na tayong last, yung common parasitic diseases in ruminants. Ito yung naman yung pinaka-common, yung liver fluke infections ng cattle, sheep, mga buffaloes, and other ruminants. So yung causative agent ng cattle and sheep liver fluke infections is Fasciola hepatica. Hindi ko malagay yung fasciola. Fasciola hepatica sa cattle and sheep. Tapos yung intermediate host niya is snails. So yung mga eggs na to, napupunta sila sa mga snails. Tapos kapag nag-grow sila dun sa snails, pwedeng tapos napunta sa tubig, pwedeng mainom yun ng mga cattle, ng mga sheep, ng mga buffaloes, or ng mga kalabaw. Ganun sila natatransmit through snails. Tapos yung species naman na nagko-cause ng liver fluke infection sa cattle at buffalo, yung Fasciola gigantica. Tapos intermediate host din nila is snails. Tapos kung makikita nyo dito, mas broad yung katawan ng fasciola hepatica kaysa sa fasciola gigantica. Tapos, next naman, may mas malaki pa dito, which is yung fasciola magna. Ito yung largest na liver fluke. Tapos, ini-infect niya yung mga domestic and wild animals. Pero nagiging reservoir or parang source of infection yung mga white-tailed deer, elk, and caribou. Although wala dito sa Pilipinas na ganito, mostly sa Australia, ganon. Nagiging source of infection sila pero hindi sila nai-infect, parang ganun. So, pwedeng makuha ng mga domestic and wild animals or mga ruminants yung infection through these reservoir hosts. Tapos yung intermediate host nila is snails din. Then, clinical signs, acute infection. Kapag may tatlong klase ng infection sa fluke infection. First is yung acute infection, next is subacute, next is chronic. Kapag acute infection, distended yung abdomen and nagiging painful siya. Tapos nagkakaroon din ng anemia. So, dahil acute infection siya, nagkakaroon ng sudden death or parang mabilisang pagkamatay ng animal. Then kapag subacute, this can happen 2 weeks to few months. Parang ganon. Tapos, nagiging extensive yung hepatic damage. Tapos nagkakaroon din ng deaths. And hemorrhage and anemia. Then yung chronic naman or matagalang infection, nagkakaroon ng anemia, unthriftiness, nagsusurvive sila pero ito nga, unhealthy sila or nangihina, parang gano'n. Tapos nagkakaroon din ng submandibular edema and reduced milk production sa mga lactating cattle and sheep. And then, ayun, end na pala. So ito yung mga references ko sa mostly yung MSD, Veterinary Manual, 11th edition. Ayan, ito yung usually ginagamit natin sa VetMed. Tapos itong mga mostly mga pictures lang yung pinagkuhanan ko. Yun, Doc.
Okay, thank you, Doc Lyle. So, any questions regarding parasitic diseases, guys? So, I'm guessing some of you might have encountered those diseases, especially yung mga breeders and may farm sa inyo. So, kayo, if may gusto kayong i-share regarding your experiences with parasitic diseases or the diseases that I mentioned kanina, feel free to share naman, guys. Para baka may hindi kami alam na common practice pala sa usapan na. Okay, with that, let's have a picture muna with Doc Lyle.
Doc, i-flash ko yung yung topic ko.
Sige, sige.
Okay lang.
Oh, na-picture na rin kita kanina with that yung topic mo. Tingnan mo yung messenger. Oh, sige, kung okay lang naman. With the on-cam yung mga students. At ayaw mag-background mo sa akin.
Saan yung camera ko? Yung... Kit naman ng logo. Doc, ikaw mag-take?
Oh, sige. Aglit. Wait lang, paano ako makikita? Okay, guys. Let's have a picture. 1, 2, 3, smile. Wait lang. Wait lang. Mahina kalaban. Second panel. 1. Ay, pinatay. O, sige.
Gali ako na, Doc.
Ito. 2 panels yan tayo, guys, since 50 plus tayo. So, first panel, please prepare your cameras. Mukhang wala na mag-on. Okay, 1, 2, 3, smile. Isan ko sa 1A. Okay, next panel. 1, 2, 3, smile. Okay. Okay, Doc Lyle, thank you very much for your
Thank you guys.
discussion
Thank
on
you,
parasitic
class.
diseases. So, good luck on your thesis. So, sa mga gustong mag-check ng long exam, you can stay. Sa mga gusto na pahinga, you can leave na.
Bye, Doc.
Bye-bye. Thank you.
Thank you, Doc. See you tomorrow.
Oo nga. Okay, bye-bye. Okay, wait lang. So, di ko nasasama ang discussion ni Doc Lyle sa long exam nyo. Ang dami pala. Baka mamatay na kayo kung bibigay ko pa yon. Pero kung gusto nyo, okay lang naman sa akin. No worry.
Okay na po.
Masayang-masaya naman akong ilagay ang discussion nyo sa exam nyo. Pero 84 slides, baka information overload na nun kayo. So, wag na muna. Sige. Sa next first years na lang. So, I will now open up AS100 quiz 1. Ay, no. Long exam 2, version 2. Wait a minute. So, madaming parasites na na-mention. So, mas marami pa kayong i-encounter na parasites pagdating nyo ng 4th year. So, sanayin nyo na. Huwag kayo agad ma-burn out sa mga scientific names. Though, of course, nakaka-burn out ang mga scientific names since you really need to memorize them. So, can you see my screen na? Ay, wait. Wait. Okay, well, ano kasing pilido niya? So, I'm requesting wag niyo muna pag-usapan sa GC ng exam na to since hindi pa pala nag-exam si Mr. Gutierrez, no? So, wala na. Hindi siya makakonect simula nung exam nyo. Nag-brown out bigla daw sa kanila. So, please don't share this on your anywhere actually. Wait lang. Since may kasama pa kayong hindi nag-exam. Wait lang. Sino pa kasi? Wait lang ha, tingnan ko sinong hindi pa nag-take sa inyo. Si Gutierrez. Tsaka si Zalameda. Okay. Si Ms. Zalameda, I doubt na mag-exam pa siya. So, okay. I'm gonna share it na. So, yun. Stop recording.